الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين وعلى آله وصحبه أجمعين. Yellow Fever by Professor Mahmoud Hani Sulaiman. Epidemiology. General description: the geography endemic part area lies between 15 degree north and 10 degree south latitude in Africa and South America, not in Asia. It is called the yellow fever belt. Again, 15 degree north and 10 degrees south latitude in Africa and South America. It's called yellow fever belt. This belt does not cross Asia. This is in Africa. The endemic part is in yellow. This is yellow part in where it is endemic. This part in gray, no risk. Low risk here and here and here in Panama. This is in South America. This is South America. In Africa, in yellow are the endemic part, as you see in Sudan, which is very related to Egypt. As you see, Sudan, this part. This part is low potential for exposure. This part is low potential for exposure. And in gray, no risk. Causative agent. Name: yellow fever virus, flavivirus. Susceptibility and resistance. Mild infections are common in endemic areas. Previous infection with dengue gives some degree of immunity. Passive immunity in infants born to immune mothers may last for 6 months. So the immunity may be transmitted to infants. Recovery from yellow fever gives lifelong immunity. Source or reservoir of infection. Animal, mainly monkeys, exit by biting. Period of communicability: human blood infected for mosquitoes shortly before onset of fever, then for 3 to 5 days. Mosquitoes require 9 to 12 days after a blood meal to become infectious and remain so for its life. Host factors: occupation, outdoor work where mosquito breeds. Recovery from yellow fever gives lifelong immunity. Mode of transmission: urban yellow fever transmitted from person to person by Aedes aegypti mosquito. Aedes aegypti. Jungle yellow fever is a zoonosis among animals. Zoonosis transmitted among non-human hosts, mainly monkeys, by various forest mosquitoes that may also bite and infect humans. Occasionally may bite humans. If these humans are bitten by Aedes aegypti mosquitoes, they become source of outbreaks of urban form of disease. So there is urban form and jungle form. This is the Aedes aegypti mosquito while it was in process of acquiring blood from human host. Reservoir and transmission in detail. Two main types. Urban type, as we said, man, mosquito, man. Requires large numbers of hosts, hence occur in large towns. Mosquito vector is Aedes aegypti, which is a domestic mosquito, breeds in or near houses. In or near. Female prefers to lay eggs in water, in artificial containers, as old tins, flower vase, etc. Urban yellow fever controlled by anti-mosquito measures. This achieved in South America. Sylvatic type, the jungle type. This may occur in endemic or episodic forms. In endemic form of monkeys constantly present and sporadic cases of humans occur from time to time. Primary spread of virus is from monkey to monkey via hemagogue species in South America and Aedes africans in Africa. Both mosquitoes live on tops of trees high. Portals of entry: biting by Aedes. Incubation period 3 to 6 days. Fixed international incubation period for yellow fever 10 days. It is fixed due to administrative procedures. Epidemiology. Yellow fever is confined by ecosystem and suitable vectors, endemic in Central America and Central Africa, but occur in unaffected areas of mosquitoes infected by migrating humans to monkeys. Infected by migrating of humans or monkeys. Case fatality 5% in endemic areas. In non-endemic area or during epidemics it may be 50%. It is 5% in endemic area. In non-endemic area or during epidemics it may reach 50%. Clinical diagnosis: yellow fever is acute viral disease of short duration, wide variation in intensity. Classic triad of jaundice, hemorrhage, severe albuminuria. Jaundice, hemorrhage, albuminuria in a small percent of severe cases. In mild, only symptoms may be headache and fever, or a dengue-like illness, fever, chills, and myalgia. Malignant cases have 3 stages: infection, remission, and intoxication. Infection, remission, and intoxication. Investigation: serology, presence of IgM in early sera, virus isolation by mice, inoculation or cell culture from blood up to 4th day of disease. Prevention. Health promotion for healthy people to raise non-specific prevention. Environmental sanitation, anti-mosquito measures, which is the same in dengue because the vector is the same. Health education, transmission, prevention, vaccination. 3. Legislation of sanitary laws, for example, international measures. Specific prevention for healthy persons to raise specific resistance. Travelers to endemic areas immunized. Those coming from endemic yellow fever immunized. Aedes aegypti controlled near airports. Animal quarantine used to prevent introduction of virus. Certification of yellow fever vaccination required for travelers over 1 year of age entering Egypt or any non-endemic area within 6 days of leaving an infected country. Yellow fever vaccination certificate is valid for 10 years and validity begins in 10 days after vaccination. Yellow fever vaccine is a single subcutaneous injection, contain viable attenuated yellow fever 17D strain virus cultivated on chick embryo, efficacy 99%, validity begins after 10 days till 10 years, should be compulsory in yellow fever belt zone, given only after 1 year of age. may cause encephalitis before this age, not given in first trimester of pregnancy, not given for immunosuppressed. Certification for vaccination, spread of disease controlled by requiring entering or leaving endemic area to possess a valid vaccine certificate. If on arrival in a non-endemic area not having certificate, then quarantine for 6 days from leaving endemic area or until certificate becomes valid. The certificate becomes valid on day of revaccination. A person is revaccination within 10 years of previous vaccination. If it is for the first time, it is after 10 days. Control to prevent spread from existing case control, early case finding, notify, isolation, a suspected case isolated for 6 days in a screened room or under mosquito net, disinfection, access of mosquitoes prevented by mosquito nets and residual sprays for at least 5 days after onset of disease, patient's house within radius of 55 meters sprayed with residual insecticide. The house itself and around it radius of 55 meters are insecticized. List contact control, list observation, immunization, population at risk, investigate contacts and source of infection, investigate places visited 3 days before onset, 6 days before onset, investigate mild febrile illness, determine presence and source of vector mosquitoes, domestic contacts isolated under net for 6 days. Epidemic measures include using mass vaccination, spraying all houses with insecticides, controlling Aedes aegypti near airports. International measures, MOH and WHO should be notified. The vector breeding sites. Please note, vector of dengue is the same, so these rules also apply to dengue. Vector breeding sites, elimination of vector breeding done rapidly. Aedes aegypti is peri-domestic breed around houses in anything that will hold water. So, suitable measures, water containers covered or screened, tins and other rubbish buried. This will simplify treatment of remainder by regular oiling or by addition of insecticidal briquettes, e.g. abate. Insecticides. Residual spraying of interiors of all houses and outbuildings or of all surfaces close to breeding places will decrease Aedes rapidly. Epidemic transmission will cease when Aedes index is reduced to less than 1%. To prevent introduction of an infected mosquito, WHO emphasizes aircraft coming from endemic zone must be disinsecticized. This is especially important in Asia, where vigorous, as you remember, the yellow fever belt does not cross Asia, so we do not want Aedes aegypti to enter these places. Where vigorous anti-mosquito measures around airports is done, international certificates of all persons coming from endemic zones, scrupulously checked, adequate quarantine of animal reservoir as monkeys instituted, international notification provides health authorities with recent information on yellow fever around the world. وفي النهاية لا أجد إلا أن أقول الحمد لله رب العالمين و thank you.